The world is still reeling from the effects of the COVID-19 pandemic. It's no surprise that people are worried another disease is making headlines. Since May of 2022, cases of monkeypox have been spreading around the world. The World Health Organization reported more than 500 cases in at least 26 countries. But should this be a cause for concern? On the program today, we'll talk more about the disease, what we can expect, and preventive measures we can take as early as now. I'm Dr. Freddy Gomez, and welcome to MedTalk Health Talk on CNN Philippines. As cases of monkeypox continue to increase, our guests are here today to tell us what we need to know about monkeypox. With us is Dr. Maria Rona M. Bergantin. She's a virologist and infectious disease specialist from the University of Santo Tomas Hospital. We're also joined by Dr. John Wong, who is an epidemiologist and the senior technical advisor of Epimetrics. Now, before we delve into monkeypox, let's first talk about smallpox. Now, it's a virus of the same family. We could say that they're cousins, and this is what spread around the world years ago. This was obviously eradicated. In terms of smallpox, Dr. John, why was this a problem 40, 50 years ago?
Smallpox had a very high case fatality rate. No? Of every 10 cases, 3 people would die. So there was a worldwide vaccination campaign to try to eradicate it.
And many survivors of smallpox would have permanent scars over large areas of their body, particularly on their faces. And some were even left blind. But the disease was eventually eradicated, and it remains the only infectious disease to achieve this distinction. Now, Dr. Rona, in terms of control, how were we able to eradicate smallpox?
One thing that is quite unique about smallpox is that human is the only known reservoir. So it's really easy to control the infection compared to monkeypox, because up until now, the scientists are not quite sure what the exact reservoir of the virus is.
The health sector works on producing newer vaccines, diagnostics, and antiviral agents in case smallpox does reappear. Now, the global response in eradicating this disease can be useful in preventing and controlling monkeypox today. Dr. John, let's talk about now monkeypox. Why is it here now? Why is it being talked about now in the news? And why is it likened to smallpox?
Monkeypox comes from the family of viruses called orthopox viruses. This is the same family as cowpox and smallpox. It was only identified in monkeys, but the reservoir are rodents in Western and Central Africa. For most of its history, it has been limited to those 2 areas. It's now in the news because this is the largest outbreak outside of Africa.
A lot of studies show that monkeypox, although a cousin of smallpox, it shows that this is less severe. Dr. Rona, walk us through some of the symptoms as well as the progression of symptoms. What does monkeypox look like, and how long does it take for the virus to show in a person?
The characteristic of monkeypox is that, of course, similar to smallpox as well as the chickenpox, which is not really related to monkeypox, is that they are characterized with skin lesions. And these skin lesions typically evolve over a few weeks, or rather, coming from the WHO as a reference site, it says that for monkeypox, it takes around 2 to 4 weeks as an evolution. So during the time of the incubation period, the patient, they say, is not yet infective. So the patient is not transmitting or shedding any virus. But once the prodrome, or the symptoms, let's say the fever, the flu-like symptoms, as well as the lymphadenopathy sets in, and the rashes also come in now, that is the time when the patient becomes more infectious and the virus is transmissible.
Let's shed some more information about this, especially on how this can be transmitted, because basically anyone can be a carrier of this. Anyone can be the one spreading this. Let's talk about that.
So the main mode of transmission still relies on the fact that there could be close skin contact. Okay, so that's coming from the lesions, and also, of course, through droplets, respiratory droplets.
Now, ultimately, the virus is not expected to create a similar scenario to COVID-19, but we should still take monkeypox seriously. Nations are taking extra precautions to prevent its spread. Dr. Rona, tell us a little bit more about these measures.
Typically, the wearing of masks, observance of hand hygiene, these are quite similar to the preventive measures we should be observing for monkeypox because, again, they are closely transmitted through secretions coming from the respiratory tract and, more importantly, coming from the skin secretion. So if we wear gloves when we are attending to our sick patients or those who are really ill, and then we wear masks, then definitely that can aid in preventing the spread. Do not forget, of course, hand washing. This is very, very important.
Now, Dr. Rona, gaano kalala ang monkeypox sa isang tao who gets infected today?
Coming from reports in Africa, mostly in Western Africa and Central Africa, the case fatality rate is somewhere between 3% to 10% with monkeypox. And the severity is more in those who have been infected from the virus, which comes from the Central African region, compared rather to the Western African region, which I think is the one which is being disseminated in outside Africa.
We know that smallpox, there was a vaccine that protected a lot of people and which eventually led to its eradication. But how many Filipinos are vaccinated for this today?
I think vaccination with the smallpox vaccine ended in the 80s, no? Mainly in Africa. No? I'm not sure about when it ended here in the Philippines, no? But for sure, no, most Filipinos would not have immunity to smallpox, no, due to vaccination, and not even through natural infection. No? So, because there's some cross immunity with monkeypox, the lack of immunity against smallpox, no, also makes Filipinos vulnerable, no, to monkeypox.
Many of the symptoms of monkeypox can be similar to that of chickenpox or varicella, a common childhood illness. When we return, we'll talk about the differences and what you can do to protect yourself. We're your partner in healthcare. Keep it here on MedTalk Health Talk. I'm Dr. Freddy Gomez and welcome back to MedTalk Health Talk. An outbreak of the monkeypox has sparked concern, but health officials report that the virus can be contained with vaccines and proper safety measures. Many of its symptoms might be confused for that of chickenpox, a very common illness here, especially here in the Philippines. Dr. Rona, earlier on the show, you mentioned how some of the symptoms of monkeypox, yung pagkakaroon ng bulutong tubig, some blister-like lesions, is similar to that of chickenpox. Meron bang way for a parent especially to be able to distinguish kung chickenpox ba ito or monkeypox na ba ito just by looking at the symptoms?
Initial symptomatology, not much probably, but then what is remarkable about monkeypox and is definitely not yet reported in chickenpox is the presence of the kulani or the lymphadenopathy, as we have mentioned earlier on. Now, with regards to the skin lesions of chickenpox or our bulutong tubig, typically this appears on the face and in the trunk. So in monkeypox, typically you see this in the face, but not much on the trunk, but more on the extremities, so hands and feet, including the palms and the sole. And also, when we talk of chickenpox, if you're going to scrutinize or look at the lesions closely, they appear at different stages. Unlike when we see monkeypox, isang particular portion ng katawan, pare-pareho yung itsura ng skin lesions nila.
In terms of monkeypox, how bad can it get? Kailangan bang ma-hospital ang tao kapag sila yung na-diagnosed with monkeypox, or is this self-limiting?
Definitely, they have to isolate themselves. If we're going to follow the recommendations of the authority, 21 days of isolation. But definitely, if we're going to have monkeypox, this needs to be reported.
We've established it is not as deadly as smallpox, but is whether or not a person dies, ito lang ba ang qualification, Dr. John, para bigyan ng pansin ang isang virus?
This is a new virus to most of the world, no, except in Africa. No? So people don't have immunity to it. No? Second, even though most cases, no, the majority of cases are mild, no, sometimes the skin lesions leave some marks, no, that can be disfiguring. So people should pay attention to what the public health officials are saying. No? we're still in a good place that we still have not identified any cases. So for now, no, the public should be more concerned about COVID, no, and trying to get vaccinated or boosted.
There was a vaccine for smallpox before. Is this the same vaccines that we need to be aware of in order to protect ourselves from monkeypox?
The chickenpox vaccine is different from what we hear about monkeypox vaccine. So the ones which protected individuals in Africa or almost the rest of the world for the spread of the monkeypox is the smallpox vaccine, rather the vaccinia vaccine, which is used for smallpox. But when we talk of the chickenpox vaccine, this is coming from the varicella virus, which is of course again a different family. And for the varicella virus vaccine, this is widely available, can be given to children and also adults who have not yet received the immunization. But when we talk of the smallpox vaccine, which is being utilized in certain sectors to protect individuals against monkeypox, so this is very limited, only for selected individuals and not for wide public use.
Right now, monkeypox, there are no cases of monkeypox here in the Philippines. But do you predict in the future that it is only a matter of time for it to arrive here in the Philippines?
Health authorities in Europe discovered it. No? There were already about 200 cases. No? So they're thinking this is just the tip of the iceberg. No? The community transmission has been going on for some time. No? And since we're not testing for monkeypox for travelers, it's possible for it to enter the Philippines unnoticed. It's still not cost effective, no, to test people for monkeypox, no, for incoming travelers. No. The most we can do is to ask about travel history and look for fever or a rash, no, for incoming travelers. But because of those, no, it's possible that it could enter the country unnoticed.
Whether it's monkeypox, chickenpox, or COVID-19, there are steps that we can take to protect from these contagious diseases. More on this when we return. Your health is our mission here on MedTalk Health Talk. I'm Dr. Freddy Gomez and welcome back to MedTalk Health Talk. While cases of the monkeypox virus continue to spread, health experts say that the risk to the general public remains low. We should still take precautions in order to reduce our risks of catching the virus or any other infectious diseases for that matter. Dr. Rona, let's remind our viewers again what is effective in controlling infection, whether it be for COVID-19 or for monkeypox.
Always continue hand washing. That is very, very important. It prevents, of course, the spread of the disease. Not just COVID, not just monkeypox, but other viruses and bacteria as well. When we're dealing with monkeypox as well as with COVID, then we use the mask. So please do not put our guards down, because these are the ones that have been protecting us over the past 2 years to almost 3 years of the pandemic.
When it comes to monkeypox, what kind of isolation time are we looking at here?
21 days as against to the shortened isolation period that we have nowadays when it comes to COVID-19. And this is the duration of isolation somehow applies to patients with chickenpox, because our audience need to know that as long as there is a crust in the skin lesions of these patients with either monkeypox or chickenpox, they are still transmitting or shedding the virus.
Now, Dr. John, speaking of protocols, with travel restrictions easing, how can the Philippines better screen for viruses such as monkeypox as well as COVID-19?
One of the most effective means of preventing outbreaks of monkeypox is to provide information, no, to the public, no? Like what we're doing now, no? What it is, how to identify it, no? What are the symptoms. No? And when people have this information, they can either self-report, no? Or report people they know, no? Their family members who have these symptoms.
There are some reports of people trying to look for a smallpox vaccine. There are some people who say that they need to be updated with their varicella vaccine in order to protect themselves from monkeypox in case it does enter here in the Philippines. Let's try and clarify the air. Let's give them some good information so they could make decisions better.
So with regards to the commercial availability of monkeypox vaccine. It's not that commercially available. In fact, in other countries, they are only given to a limited number of people, most especially the ones who are working in laboratories or, let's say, in healthcare units where there is a high risk possibility of exposing themselves to monkeypox. Now, with regards to varicella virus vaccine being given to prevent, again, monkeypox. So again, to emphasize, they are a different family. So when you update your varicella vaccine, that means you're going to have yourselves protected from varicella, but not from monkeypox.
Now, before we let both of you go, do you have any additional tips for our audience which they can use in order to protect themselves from monkeypox? I'll start first with Dr. John.
The most important thing that they can do is just continue listening, no, to the public health officials, no, what they're saying, no, whether or not there are cases here in the Philippines. No. However, no, it's the public health officials, no, who have to pay attention, no, to the introduction of cases here in the Philippines. No. We need better surveillance, no, and better information to the public.
Okay. And of course, Dr. Rona, do you have any advice for the viewers?
Probably one thing that I have to emphasize, which has not been tackled a bit earlier on, is the avoidance of eating meat coming from other countries, which are, of course, not authorized by our health sector. Because one of the means of spread also of monkeypox is through the bush meat. And that also needs to be looked into. When we talk of exotic meat coming from other countries, which of course we would want to taste, and these are not authorized to be imported or bought inside our country, then definitely it has not been passed through the assurance that they are free from infection. And because games, fowls, and also animals which are consumed in those areas coming from Africa or from those areas where these monkeypox virus is, then they should be regulated.
Thank you so much, Dr. Maria Rona M. Bergantin and Dr. John Wong, for being with us today. We appreciate your time and your expert insights. I'm Dr. Freddy Gomez, and thank you for watching MedTalk Health Talk. We'll see you again next time.